Hi, I'm Dr. Paul Hoffman. I'll be performing your injection today. First of all, I'd like to say, I always tell my patients not to believe horror stories that they've heard. Those are mostly true of pregnancy epidurals and epidurals done about 10 or 15 years ago. We're going to be very gentle with you today and take good care of you. Believe it or not, the worst part most people tell me about this injection is the cold soap we use to paint the back up with, and the local anesthetic, the lidocaine we use to numb the skin surface. Same medicine the dentist uses, or if you've ever had stitches. Beyond that initial little stick and sting of the lidocaine, you should feel really very little pain, maybe some pinches and cramps, but not big pain. And if there is, I want to know about it. I'm not here to torture you today, I'm here to make you feel better. As I push the medication along the irritated nervous structure in your back, you may feel some pain or pressure radiating into the same areas in which you've had pain and pressure. If that's uncomfortable, you'll let me know. I'll slow down how I push the medication in. Once we get some numbing medicine along the nerve, it's like typically instant relief. Your job when we're done with the injection today is to go home and be a couch potato. I really want you taking it easy, doing a lot of nothing today. Recliner, lounge chair, bed, whatever you're comfortable in. Just kind of laying around watching a good movie or reading a good book. The more you can relax today, the better the medication is going to soak into the area of problem and the better response we're going to get. Tomorrow, light activities. The next day, kind of resuming your normal activities or restrictions, just with the realization I did not put kryptonite or superpowers in your back, so just don't overdo it. Risks of injection are always the same when doctors do this. Those risks are bleeding, skin discoloration, nerve damage, infection, worsening pain, spinal leak headache, spinal cord injury, arachnoiditis, and death. Those things are all very rare, but I'm duty bound by law to tell you every bad thing that ever happened on the planet after one of these injections. 3 common side effects, and if they occur, how to deal with them. Number 1, some people are very sensitive to steroid medications. For the first few days, they can feel somewhat hot and flushed, nervous and jittery, like a lady having a hot flash. If that occurs, get a nice cool environment, drink lots of cool liquids that will help to ease that off. Second most common thing is sometimes for the first couple days the pain can get up a little bit and then start to come down. If that occurs, best thing to do is to use your pain medicine. Realize that's a normal part of this, and that the steroids usually kick in about 24 to 48 hours. I've seen them take up to a week to kick in, but most people are feeling dramatically better in about 24 to 48 hours. Third most common problem is headache. The best way to prevent that from happening is, if you like coffee, to stop by McDonald's or Starbucks on your way home and get a good cup of coffee or coffee creation. This allows you to get some caffeine and pre-medicates you and keeps you from having a headache. If you get a headache over the next few days, lay flat, dark room, drink something caffeinated. That usually eases it right off. If you're not a coffee drinker, Mountain Dew or Dr. Pepper are good alternatives. I'd again like to thank you for listening to our video today. Realize I will be by personally to talk with you before the injection and answer any and all questions you have in regards to the injection. If there are any complications or problems, we ask that you contact our office, 423-265-2233. Thank you very much.